Hello and welcome to the 2017 Benefits Open Enrollment Brainshark for information about your benefits for 2017. Please be aware that if you are participating in our Wellness Rewards program and you are looking to earn points, that this presentation will be available on the WellWorks for You website, and you will be able to get 10 points for listening to this presentation. So I just want to stop everybody now. And if you didn't get to this presentation by going through wellworksforyou.com, you want to go there so that you can listen to the presentation online through WellWorks for You. Then there's like a little questionnaire at the end, and then you get 10 points for your wellness rewards, okay? So I just want to make sure that before anybody starts listening, they're aware of that. All right? Thanks. And this is Tony Rice from Human Resources at the hospital here at Hunterdon Medical Center. I'm the benefits coordinator. My contact information is here for you. My email address, arice@hhsnj.org. If you have any questions, please feel free to email me, or please feel free to call me, 908-788-6133. That is my direct line here at the hospital. So we hope that this presentation will be helpful to you and convenient for you to get to so that you don't necessarily have to come to the auditorium. However, we will be doing presentations in the auditorium. We are available for on-site presentations. If you call us and let us know that you'd like to come, us to come and present in your specific area, your department, your off-site location, we are happy to do that. Also, just a little reminder that this presentation has been set up to match the booklet. So the booklet was emailed out earlier. The booklet is available, hard copy, in Human Resources, and it's been distributed during the benefits fair. So if you have a booklet, about slide 8 maybe, it starts to follow along with the booklet. So the booklet is handy to kind of take notes and circle things as we go. So this slide is just really kind of a timeline about open enrollment. We began, pushing information out the week of October 24th. We had our benefits fair on the 2nd of November in the employee cafeteria, began distributing information there as well. We've already sent out, emails and booklets and all that kind of stuff electronically. Benefits meetings began in the different off-site areas Friday the 30th. And we will open up Kronos on Tuesday, November 8th, for employees to begin going in and actually making new elections, reviewing their current elections. We strongly encourage you, even if you're not going to make any changes, to please go in and take a look at these elections and evaluate the plans, as opposed to just letting them roll over. And the process will end on November 22nd at midnight. So some other opportunities for education and communication during open enrollment include, of course, this Brainshark that you're watching now. We have booklets available. We've sent them out via email. We're sending them out in our office. People have requested that we send them. They're available in Human Resources at the table in front of HR. We have presentations going on in the auditorium again and upon request in departments and offsites. And we round through the hospital, usually during the open enrollment period, to see if anybody has any questions about benefits, to make sure that everybody can get online and they can get through the process. So if you have any questions, again, reach out to Human Resources. There's lots of information out there. If you need any help, just let us know. So some other things that we're doing is emails. Of course, we send out our HHS notifications throughout the open enrollment process. We will send out inter-office memos. We've got posters in the cafeteria. We have a slideshow up going on near the Human Resources in the cafeteria. We always have an open enrollment display in front of Human Resources. We post everything on the intranet. And we have a postcard going home as well, just as a general reminder for those. Some people don't always get information via email. Sometimes it's a spouse maybe at home that's taking care of it, the enrollment process, so or decisions rather. So we like to send a postcard just as a backup in case people don't get the information electronically. And we do try to reach out to areas that we know don't use electronic communication as frequently as others, so we focus on those areas as well. So this slide is just a general reminder that the hospital has changed its definition of a full-time employee for the purpose of benefits, and the benefits we're talking about are medical, dental, and vision. So now an employee, regardless of their status at Hunterdon, is eligible for benefits if they're averaging 30 hours a week when the hospital does what's referred to as a look-back during a measurement period. So we go back and look back over a year to see which employees have worked 30 hours, even though they might have been per diem, even though they might have been part-time 2 or part-time 3. They've worked more than the expected hours. They've worked 30 hours on average, so they should also be eligible for benefits. If they are, now, they will be offered not only medical, which is what the law requires, but the hospital is going to offer dental and vision as well, and they will pay the same rate that a full-time employee would. So the definition of a full-time employee for the purpose of medical, dental, and vision is now someone who's actually working 30 hours a week. So effective 1/1/16, we introduced that new definition. So any employees that were hired after 1/1/16 were not offered benefits if they were scheduled less than 30 hours a week, because they have to work 1 year and then average 30 hours in that 1 year to be eligible for benefits. And so we track that. Every month we look to see the new hires from the previous year. Did they meet this criteria? During open enrollment, we do one big look back for everybody that was scheduled less than 30 hours a week. Okay? So that's kind of how we measure this piece. For employees that were still in the part-time 2 benefits during 2016, they now have to qualify. So anybody that was already in the part-time 2 category of benefits in 2016 were considered grandfathered, right? They weren't new hires, and they were already in the part-time 2 category. We grandfathered those employees for 1 year and said, you know, you need to meet this 30-hour rule to be able to continue your benefits in 2017. So we will go back and look and see who's met the 30 hours, and they'll be offered the opportunity to continue those benefits, and they'll be paying less for them now, right, because they're going to pay the same as full-time employees. Or if you didn't meet that criteria and you had benefits, we'd issue you the opportunity to continue those benefits under COBRA. And next year, if you work 30 hours on average, you could be eligible. So just be aware that this new ACA definition, Accountable Care Act definition, creates a little bit more complexity, so just be aware of that. If you have questions, please come down to Human Resources. We'll be happy to kind of explain this in a little more detail, or if it's how it specifically applies to you. So if you were impacted by any of this, you will receive notification. And then the last reminder, general reminder about things that are happening during open enrollment is the new tax forms. So last year we issued 1095-C forms. Those are the forms that show who was and who wasn't enrolled in medical benefits at Hunterdon during the year. Last year, we kind of did a dry run. You didn't really need that form for taxes. This year, you do. You do need that form this year to file your taxes, so be watching for it. It's going to be distributed around the same time as your W-2 because it's a tax form. So this year, you will need your 1095-C form to file taxes. And this slide is just reminding you of which benefits do automatically roll over and which benefits do not automatically roll over. So if you have medical benefits elected, if you have a health savings account, you have dental, you have vision, voluntary legal, you have a gym membership, those benefits are going to roll over for you. You don't need to do anything with those. However, if you have a dependent care flexible spending account, a medical or a health care flexible spending account, or you choose to buy back some of your PTO, you buy back 1 or 2 hours of PTO, those you must re-elect every year. We don't want to assume that you want to re-enroll in a dependent care. Maybe your child is too old for dependent care this year. We don't want to assume that you want a flexible spending account. Maybe you want to, maybe you don't have something going on, you don't need as much money in it. Okay, maybe you want your PTO this year, you don't want to buy it back. So we're not going to make an assumption about those. If you want to maintain those, you have to go online and you have to re-elect them, or else they're going to be inactivated for 2017. And we're going to go over some more highlights and reminders here. Just please be aware that now we are at the first page of the booklet. So the booklet now follows along with the rest of this presentation. So if you want to get your booklet out, now's a good time. FSAs, the maximum you can contribute to an FSA has increased this year to $2,600. So the most you can put into a medical flexible spending account is $2,600. You can put in less, but the most you can put in is $2,600. And please remember, FSAs, medical flexible spending accounts, are use it or lose it accounts. If you put in more money than you can spend, you will forfeit the money at the end of the year. So please, pay attention to how much money you're putting in there. We don't want anybody losing money. So be aware of that. We've added back, yay, 90-day refills. Employees were asking for 90-day refills at the retail pharmacy, and it is back at the Hunterdon Regional Pharmacy as well as many of the retail pharmacies across the country. You have to go to one of Aetna's what they call extended day supply network pharmacies, which is basically all the major, pharmacies, chain pharmacies across the country. There's 68,000 of them. So you now are able to refill your prescriptions for 90 days. Social Security numbers for dependents, please remember that they are required. We have to collect them. So if you don't put a Social Security number, an accurate Social Security number in the system for your dependents, they may not be enrolled. They're not going to pass to the carrier. So please be sure if you're putting a dependent on the plan that you are including their Social Security number. Remember, if you're adding a spouse to our medical plan, we need to collect a spousal attestation form. Spousal attestation forms are available online when you go through the enrollment process. They're available on the HHS intranet. They're available in the Human Resources Department. If you need one, please be aware that your spouse must sign it as well. So you have to take one home and have your spouse sign it. So your signature is required on it, and so is your spouse's, and then you submit that to Human Resources. If you're electing the HMO plan, you need to select a primary care doc for yourself or for anyone on the plan. So you will not get a card until you actually select a primary care physician. Now, if you already have done this, you have the HMO, you already have a primary care doc selected, this is a non-issue for you. But if you are electing the HMO for the first time, you're going to make the election, you're going to get a letter from Aetna, they're going to ask you to choose a primary care doc for yourself or for anyone on the plan. They're going to notify you via letter, and then you're going to either call them or go online to make that actual election. So please be aware you will not get a card until you tell them who your primary care doc is, because they're going to print that primary care doc's name on the card, okay? If you switch from the high deductible plan to the HMO plan, and you have a health savings account, please be aware that you will become responsible for the $5 a month account fee that's associated with it. So there's a maintenance fee that goes with the health savings accounts. When you're enrolled in the hospital's plan, in the high deductible plan, Hunterdon pays that fee for you. If you leave the high deductible plan, but you maintain the health savings account, now you're going to be responsible for that fee. It would happen if you switched to the HMO, if you switched to, Medicare, if you left our organization and went to another employer, but you kept that HSA, you would become responsible for that fee. So just be aware of that. We will be doing a dependent audit in 2017. So any dependents that you're putting on our plans this year, we will have an audit in 2017, first quarter, and you will have to provide documentation showing that those are legitimate dependents. We do one of these audits every couple of years. This year's it. And we will have a company called BMI doing an audit on the dependents. And then lastly, please be aware, again, information is available on the hospital's intranet. If you go to the intranet to HR, there's a link for Know Your Benefits, and Know Your Benefits has pretty much anything you can get into in Human Resources, you can get online. And so it's all available to everybody, whether you're at the hospital or you're one of our off-sites. We want people to be able to get to the information. So please be aware that a lot of the details about our plan designs are available online on the Know Your Benefits link of the HHS intranet. So on this line, we're talking about eligibility again. And the big change here for us is that we're now using the new Accountable Care Act, or ACA, regulations to define full-time eligibility we talked about earlier. So one of the ways you can kind of distinguish eligibility criteria is, are you somebody that's regularly scheduled 30 hours a week or more already? Really nothing has changed. However, if you are somebody that is part-time 2, part-time 3, or per diem, these are people that would perhaps be scheduled less than 30 hours a week, but maybe work 30 hours a week or more. People that would be kind of what they call a variable employee, because they have varying schedules, right? They might be scheduled to work 0 hours as a per diem, but they could be working 40 hours, right? You could be a part-time 3 employee scheduled to work 15 hours a week, and maybe you're working 20. So people that fall into the category of a variable employee or a variable schedule are employees that may or may not be working the hours that they've been hired for. They could be working more, they could be working less. So just be aware that there's kind of 2 buckets. If you're in a regular schedule where you're working 30 hours a week or more every week, the ACA doesn't really apply to you in a sense, because the ACA really applies to people that are scheduled to work less than 30 hours but could be working more and therefore should be eligible for these benefits. Who can you cover? So if you are somebody that's regularly scheduled 30 hours a week or more, you can cover your spouse, you can cover your dependents. Your medical plan, your spouse can be covered as long as they do not have access to another employer plan, right? If you are somebody that is qualifying under the ACA, so you've worked here for a year, you're averaging 30 hours a week, now you're eligible under the ACA guidelines for benefits, you can cover yourself, you can cover your dependents, but spouses are not eligible under the ACA regulation, okay? So just something else to be aware of. What if things change? So if anything's changing for you and you think that it makes sense to you that you should be able to change your benefits, you're probably right. You know, if you have a baby outside of open enrollment, does it make sense that you should be able to add that baby to your benefits? Yes, you should. If you get married after open enrollment, does it make sense that you should be able to change your benefits because now you're married and your spouse might have benefits and you might want to do things? Yes, it does. So there are times when you can change your benefits outside of open enrollment, but there has to be what's called a qualifying event. So there's very specific reasons why the IRS will allow you to make changes. You just need to come down to HR right away. Don't wait. Come down right away and let us know what's going on and help you figure out what you can do. They say now we're on page 3 of the booklet, and the question is, do I need to enroll during open enrollment? And the question is, maybe, right? Strongly encourage everybody to go out and check their benefit elections during open enrollment. However, you know, some benefits do roll over, right? Employees love to say, oh, I love it, I don't have to go out and enroll anymore, they're going to roll over. Some of them roll over, not all of them roll over, okay? And if you are a part-time 2 employee this year, and you've got this new thing with the 30-hour rule, I would strongly encourage you to make sure that you're following up and don't assume that things are rolling over for you, okay? Definitely get in there and take a look. And we're going to be looking too, right? We're going to be tracking that closely as well to make sure that everybody's information is accurate. But we talked earlier that not all benefits roll over, okay? FSAs do not roll over. PTO does not roll over. So would strongly encourage you to go online and take a look at your benefits. However, if you don't, your medical, your dental, your vision, your legal, some of those other things, they will roll over for you, but not everything. When can you enroll? Well, during open enrollment, of course, right? That's the purpose of open enrollment. The purpose of open enrollment is to allow people once a year to go in and make changes for any reason whatsoever, just because. So that happens for us in November, which is what we're doing. And also if you're in Medicare, right, Medicare programs, their open enrollment is in November and December as well. The other time you can change your benefits or enroll in benefits is when you have a qualifying event, right? Something's happening outside of open enrollment, you need to make a change. New hires, right, new employees coming into the organization are considered to be a qualifying event. They have access to new coverage. You know, if you have somebody that's lost coverage, that's a qualifying event. Again, a death, a birth, a divorce. Those are all qualifying events. You can make changes to your benefits. You just have to come down right away and let us know. Can I drop coverage? Now, this is another question we get quite a bit. During open enrollment, yes, you can drop coverage. Again, we said open enrollment, that's the whole purpose of open enrollment, is to be able to make changes to your benefit elections for whatever reason. Again, can you drop coverage if you're experiencing a qualifying event and it makes sense? So if you are enrolled with benefits at Hunterdon, and let's say your spouse or someone just gets a new job somewhere else and they have benefits and you want to move the family to their new benefits that are being offered, yes, you can drop the benefits because it makes sense. You've been offered new coverage elsewhere. So you can drop benefits during open enrollment. You can drop benefits if you have a qualifying event. Again, just got to do it right away. Now, here's some caution I want to put out there for people. People are finding this out. Under the new ACA regulations, if someone has qualified for benefits, changing your status doesn't necessarily mean that you can drop benefits anymore. Okay, so you have to be careful with this. A lot of times employees would say, you know what, if I drop to per diem, I can drop my benefits. And, you know, that's sometimes the reason why they're doing things, because that's the way the rules used to work. It doesn't work like that anymore. So if I am somebody, let's say, who is a part-time 2 employee, and I have medical benefits at the hospital, and I want to drop them. So I go to my manager and I say, I'm going to go per diem because I want to drop my benefits. Well, under the new ACA rules, changing your hours isn't going to be a qualifying event anymore. All right, so you just need to be careful with that. Because if you qualified based on the fact that you averaged 30 hours a week in the prior year, it doesn't matter what status you are for the next year. You're eligible for those benefits based on what you worked the prior year. So just be careful when you're moving around statuses. Just because you've changed a status in the organization does not necessarily mean that you're going to be eligible to drop benefits, okay? So just be careful with that. And another one is a life event, and we've talked about, again, what qualifies as a life event: a death, a divorce, a loss of other coverage, the access to new coverage, access to Medicare, access to a new employer's plan. Those are the sorts of things that would allow you to drop coverage and pick up new coverage somewhere else. So now we're on page 3 of the booklet if you're following along, and the section here talks about how do you enroll. So to get into the system to enroll, to actually make your elections or to review your elections, you're going to go into Chronos, right? So pretty much on any desktop in the organization, there's that little blue and white clock. It's half blue, half white, and it's a little time clock. That is your icon for Chronos Workforce Central. So you're going to click into that. You're going to log in, and when it opens up, you're going to go to the My Information tab at the top. And from the My Information tab, you're going to go to the Employee Home page, drop down. And then when you get to your Employee Home page, on the left side towards the top, you will see a little link that says Benefit Enrollment Link. And you're going to click on that link, and it's going to walk you through the pages to make your benefit elections. So on this slide, we're talking about the Hunterdon Home Network. At Hunterdon, we have a special network within our own organization. So the question is, who's in it? But who's part of the Hunterdon Home Network? So the Hunterdon Home Network includes the Hunterdon Medical Center, of course, services that the Hunterdon Medical Center provides. It includes physicians who are contracted with Aetna and also have privileges within Hunterdon, okay? And that's not all physicians that are at Hunterdon, so be careful with that. But if a physician works at Hunterdon and they also have a contract with our Aetna plans, they will be considered part of the Hunterdon Home Network. Outpatient services provided within our organization are considered part of the Hunterdon Home Network. So our laboratory, our outpatient laboratory that's located on the first floor of the ground floor of the doctor's office building, that's part of Hunterdon Home. If you have laboratory services done at any of our practices, right, those doctors at the practices are considered part of Hunterdon Home. If your blood work is being collected at one of our practices and being sent to Hunterdon to be processed, that would be considered part of Hunterdon Home. Radiology services provided by the hospital within our Hunterdon Home Network are considered, of course, part of Hunterdon Home. The Women's Imaging Center, our new urgent care, things that the hospital owns, those are part of the Hunterdon Home Network. Now, there's a larger list, again, on the HHS Internet. This is just some of the things. But I do want to caution you, not everything that is within the walls of what we think of as the hospital or the Hunterdon main campus is part of Hunterdon Home, is part of the Hunterdon Network, okay? Here are some basic exclusions, all right? These aren't the only ones, but these are the ones that I see most often that employees contact me about. The first one is the Hunterdon Endo Surgery Center that's in the doctor's office building. They are in network with Aetna, but they are not considered part of Hunterdon Home, okay? So there's a difference. So they do accept the hospital's contract, but we do not own the Endo Surgery Center. We do not bill for that surgery center. It's not ours, so it's not considered part of the Hunterdon Home Network. Quest Diagnostics, they are in network with Aetna, but that's not part of the Hunterdon Home Network, right? We aren't Quest. Our laboratory is Hunterdon Medical Center, not Quest. Durable medical equipment, if you're going to a physician within the Hunterdon Home Network here at the hospital and you're purchasing durable medical equipment through that office or through them, that is not part of the Hunterdon Home Network. The physician may be, but the durable medical equipment is coming from somewhere else, and that's not part of Hunterdon Home. So just those are some examples of things that trip people up sometimes, and they think that they're using the Hunterdon Home Network, and they aren't, okay? Now, part of the Hunterdon Home Network benefit includes special pricing. So not only do you have providers that you can go to and that are considered part of the Hunterdon home. But when you use those providers and you use the hospital services, you also get special pricing, meaning that you're paying less than the average patient would because you're a hospital employee on our plans or your dependents are on our plans. One of the first things is the urgent care, our new urgent care center. We strongly encourage for non-life-threatening situations that employees use their primary care office as the first option, right? You go to see your doc, and it's probably going to be the most cost-effective for you too, right? It's going to cost less to go to your primary care doctor's office than it is to go to the urgent care or to the emergency room. So that's what you kind of want to think of first. However, sometimes you can't always get to your primary care doctor's office, and then that's when you start thinking about, well, should I be able to use the urgent care for this service and at least save some money instead of going to the emergency room, or is it appropriate to go to the emergency room with something like this? So you want to think about, the different ways that you can get care, and of course you want to get the most appropriate care, but not only what's most appropriate, what are the cost factors here as well. So if you come to your primary care doctor's office at Hunterdon, and you have the HMO plan, and you're using a Hunterdon home doc, it's going to cost you $20. If you have the high deductible plan, it's going to cost you $110 because you're paying for the actual cost of the visit in the high deductible plan. It's being applied to your deductible versus the HMO. To go for a primary care office visit, there is no deductible. It's a flat copay, and you're going to pay $20. If you go to our urgent care, you get a special price. It's $210 in either plan. And if you go to the emergency room, you're going to get special pricing, but it's still going to be more expensive than the urgent care or your primary care doctor's office, right? And your urgent care visit is going to have more bills associated with it. You might get a bill for the emergency room, you get a bill from the emergency room docs, you might get a bill from the radiology group. So if you go to the emergency room, you're going to have multiple bills and probably a bigger bill to start with. If you go to the urgent care, you're going to have a flat fee of $210, and it's going to include everything, one bill. And of course, if you go to your primary care doctor's office, you're going to have probably a less expensive visit, $20 copay in the HMO, maybe $100, $110 if you're in the high deductible plan. So some things you want to think about. Also, what you want to think about when you're going to the urgent care is, what do you go to the urgent care for? Minor lacerations, ear infections. You want to think of the urgent care as somewhere you would go for immediate care. You can't get to your primary care doctor's office for some reason, but you really need to get this thing fixed. And it's something that you can go, get treated, and you're done, right? You don't want to think about the urgent care necessarily for something like a Lyme's test. Okay, that's, I guess, one that's coming up quite a bit, and because it's something that requires follow-up care, right? If you go in to the urgent care and you think you need a Lyme's disease test because you think you've been bit by a tick, they're probably going to refer you to your primary care doc because that's something that's going to require a lot of follow-up care. If you show up and you're looking for care for abdominal pain, you've got really severe abdominal pain, they're probably going to refer you to the emergency room because they may need more blood work for something like that. They may need an ultrasound for something like that. You may be referred to the emergency room. If you come in with chest pain, and that chest pain you think is associated with some kind of cardiac condition, you're probably going to be referred to the emergency room there as well. So just kind of be mindful about what you're going to the urgent care for. And so, if you need to go to the emergency, by all means, go to the emergency room. If you show up at the urgent care with some of those things, they may refer you to the emergency room anyway. So here's some more information about the special pricing we have here at Hunterdon for general radiology services and for general laboratory services. The benefit to employees is that they should cost you nothing for the hospital services, and then nothing applies to your deductible. So basically there's no deductible, no cost associated with general radiology services and general laboratory services. There's no deductible, and you pay zero for those services at Hunterdon Medical Center. A couple things to be aware of. In the radiology area, the service that the hospital provides is not going to be billed to you. You're not going to be responsible for the deductible. However, the read fee that's associated with that service will be charged to you by Hunterdon Radiological Associates, okay? So if you're coming in for a mammography and you come into the radiology department and we say, we're going to do your mammography, would you like the 3D tomo? Maybe you need an ultrasound for your particular mammography. those services you're going to pay $0 for, nothing's going to apply to your deductible. However, there's a read fee for that mammography. There's a read fee for the 3D tomo, and that's going to be coming to you from 100 Radiology Associates, and you will be responsible for that. Another one that comes up sometimes is vascular studies. Those are not in the category of general radiology services. So you will see reduced pricing for the vascular study done at Hunterdon, but you will not, you're going to pay something for it. It's not going to be applied to the 100% coverage pricing. There's a cost for it. General laboratory services, again, covered at 100%. There's no deductible, so there's nothing being applied to your deductible. No deductible applies for general laboratory services done here at Hunterdon. To be done at Hunterdon, they need to be collected and processed, the tests at Hunterdon, the blood tests. So you can go to one of our draw sites. We have a draw site in the Sand Hill building. We have a draw site in the Health and Wellness Center in Clinton. We have our outpatient lab on the ground floor of the doctor's office building. So if you're going to any of those draw sites, that's going to be, blood work collected at Hunterdon and part of the Hunterdon Home special pricing, no cost to you. If you go to one of the family practices that we own and they collect your blood at the family practice and that practice sends your blood work to Hunterdon, that's going to also be covered at 100%, no deductible, you pay $0, all right? So just be aware of that. That's a great deal. If you're worried about the deductibles on the plan, sometimes employees will say, oh my gosh, these deductibles, but there's a lot of things that the deductible doesn't apply to now, so that's a good thing. Pathology services are not considered to be general radiology. So that's something else to be aware of. And lastly, please, if you're coming to one of our outpatient labs, please bring just a general laboratory script. We are not LabCorp. We are not Quest, so we don't want to be using their requisition forms, right? We just want a general laboratory script. And it's also less likely that there's going to be a mistake made and your blood work is going to be sent somewhere in error if you're using a general laboratory script, okay? So just something to be aware of. Have a little caution with that. Special pricing also includes inpatient services. So if you're coming to Hunterdon and you're an inpatient, you will be charged Medicare rates, generally recognized as the lowest rates that you can be charged. So the hospital is going to charge you Medicare rates for your inpatient services. If you come to the hospital for other services that we haven't talked about, maybe child development services or physical therapy services, something like that, the charges that you're going to have are going to be based on 36% of what Hunterdon's normal charge would be. So you're basically paying, 36 cents on the dollar for other hospital services at Hunterdon. Special pricing applies to employees and their dependents. So anybody that's on your medical plan is going to have access to these reduced pricing for their services. Just the other thing, again, reminder, special pricing does not apply to services for providers that might work within the organization. They're here, but they're not Hunterdon owned. They're not hospital owned. An example of that would be Pegasus Emergency Group, right? That's the physician group that works in the emergency room. If you're going to the emergency room and you get a bill from the Pegasus Emergency Group, that is separate from Hunterdon Medical Center. It's not going to be subject to the special pricing. Hunterdon Radiological Associates, again, not owned by the hospital. You're going to be responsible for those bills. So here we're looking at the two medical plans that are offered by Hunterdon. We have the Aetna Select HMO plan, and we have the Aetna Select High Deductible plan. And we're going to talk about the HMO plan first. Just so you know, we've got about maybe a 60-40 split between hospital employees. 60% of our employees are in the high deductible plan. 40% of our employees are in the HMO plan. The HMO is gaining more ground, more popularity, I think, as people become more comfortable with it. I think some people have stayed in the high deductible plan simply because the benefits roll over, right, and they're not looking. But I would strongly recommend employees to get online and take a look at both of the plans. So in the HMO plan, you have the Aetna in-network level of benefit and your Hunterdon home level of benefit. So you can go to any doctor that takes Aetna in the nation, right? You can go to any doctor that takes Aetna, and if you go to a doctor that takes Aetna and is not part of Hunterdon Home, your deductible for individual is $2,500 and for family is $5,000. The out-of-pocket maximum, the most you could possibly spend in a year, is $3,000 for individual and $6,000 for family if you're going to an Aetna in-network provider outside of Hunterdon, okay? However, if you find an in-network Hunterdon Home doc who also takes Aetna, right? So you're going to a doctor that takes Aetna and they also are part of the Hunterdon Home tier, then your deductible is $1,000 for single, $2,000 for family. Your out-of-pocket maximum for single, most you could possibly spend in a year, is $2,000 for an individual and $4,000 for a family. Okay, so using an Aetna in-network provider who is also within the Hunterdon Home tier is going to lower your out-of-pocket responsibilities for the deductible and the coinsurance or out-of-pocket maximum. It also lowers your copays, right? So if you go to an Aetna in-network doctor outside of Hunterdon, your copay for primary care is $25, your copay for specialty is $60. If you find an Aetna in-network provider within Hunterdon Home, you're going to pay $20 for your primary care copay, $40 for the specialist. Prenatal care is covered at 100% in either plans, but just be mindful that's not everything across the board. That's very specific things. So don't just assume that anything that's related to a maternity diagnosis is covered at 100%. That's not how it works. It's more like office visits, the standard office visits that you go to for prenatal care. Again, be aware of the Hunterdon Home special pricing for all of your services. But if you're using diagnostic and laboratory services outside of Hunterdon, you're going to pay your deductible, and then you're going to pay 30% after that until you hit your out-of-pocket maximum. If you're using radiology and diagnostic services at Hunterdon, general ones, most of them, you're not going to pay anything for the hospital service, and nothing's going to apply to your deductible. And that would be basically in both plans as well. Inpatient stay at Hunterdon is a lower deductible and 10% after the deductible. But keep in mind, much lower prices for your inpatient stay at Hunterdon. We've reduced our prices to the Medicare rates for you. Emergency room, again, lower prices at Hunterdon Home, subject to 10% coinsurance for the emergency room. And for Hunterdon, our urgent care is a $210 flat fee. Versus if you go to the emergency room, you could pay whatever the cost is, apply to your deductible, 10% after that. It's a flat fee for the urgent care if you're using one of Hunterdon's urgent cares. In the high deductible plan, the deductibles for the Aetna in-network level are the same, right? So if you're going to a doctor that's in the Aetna network, however, they're outside of Hunterdon, you're going to pay $2,500 for family, $5,000 for family, $2,500 for individual. Your out-of-pocket maximum, which is, your deductible plus what you pay in coinsurance, is $3,000 for individual and $6,000 for family. So basically the same in both plans. If you're using Hunterdon Home in the high deductible plan, it's $1,300 for the individual deductible, $2,600 for family, $2,500 for the individual out-of-pocket maximum, and $5,000 for the family out-of-pocket maximums. So the deductibles in the high deductible plan are higher if you're using Hunterdon Home, and the out-of-pocket maximum cost altogether, what's the most you can spend in a year, is also higher in the high deductible plan. However, you do get cash from the hospital into your health savings account, $250 for single people, $750 if you have a family. And that health savings account is really what drives this high deductible plan, right? If you're in the high deductible plan, you really should be contributing to that health savings account. That's the value on this plan, right? It's to be able to put away money that rolls over year to year and basically build a tax-free savings account for medical expenses in the high deductible plan. That's one of the biggest benefits to being in this plan, okay? So really think about, if you're in the high deductible plan, are you using that health savings account? Does it have value to you? And if it doesn't, you might want to look a little bit closer at the HMO plan. You can do an FSA in the HMO plan. There's no deductibles for office visits. There's no deductibles for pharmacy in the HMO plan versus the high deductible plan. Everything is applied to the deductible out of the gate. Your pharmacy, your the office visits, everything. You're paying the cost of everything, and it's all applied to your deductible in the high deductible plan. So please understand how those plans work and look at them closely. If you have questions, if you need more details, please feel free to reach out to us, and we'd be happy to sit with you and talk to you about the differences between the plans. So here we're looking at the prescription drug benefits in both of the plans, and very excited to be able to tell you that we are able to do 90-day fills at retail pharmacies again. So that would be our 100 regional pharmacy here at the hospital, but pretty much all the major chain retail hospitals across the country now, you can get the 90-day refills again. So that was something employees had asked for, and it's back. So again, thank you for those of you that reached out for taking the employee opinion survey, for putting that feedback in there. It really does make a difference when you take those surveys or when you give us that feedback. So here's a change as a result of information coming back to us. So 90-day refills are back again. And you just want to be aware that if you're in the HMO plan, there is no deductible applied for pharmacy. It's a copay for all your pharmacy. It's going to be $10, $25, or $50. Now you can go to a retail pharmacy, and it's not reflected here, but it's going to be updated. Not only can you get a 30-day supply, but you can get a 90-day supply. You will be responsible for the copays, but you can now get a 90-day refill at most retail pharmacies. If you are in the high deductible plan, remember, you must first meet your deductible before it flips and you pay a copay at the pharmacy for your medications. So in the HMO plan, you're always subject to just the copay to pick up your prescriptions. In the high deductible plan, you must meet your deductible. Once your deductible is met, now you become responsible for copays for those medications until you meet the out-of-pocket maximum. Once you meet the out-of-pocket maximum, now on either plan, once you meet the out-of-pocket maximum, there's no cost for those prescriptions after that. Another thing to be aware of with the pharmacy plan is that you have a preventive medication list in the high deductible plan. So there are some medications in the high deductible plan that bypass the deductible, which means that you do pay the copay immediately. If you have to pick up a prescription for something, maybe it's related to diabetes, maybe it's related to asthma, maybe it's related to heart disease. Certain diagnoses and certain medications will bypass the deductible and you only pay the copay. Even on like January 1, you haven't paid anything towards your deductible. There are some what they call preventive medications, something that prevents a heart attack, something that prevents diabetes, something that prevents an asthma attack. Those medications you pay just the copay for, even at the beginning of the year if you haven't met your deductible. You know, and again, information on both plans, new ACA regulations cover contraceptives at 100% no deductible. Again, not all, but most. And then there's other healthcare reform medications. Smoking cessation. So be aware that smoking cessation medications are covered under our plan. So if there's anybody out there that would like to try and quit smoking and you don't think that that stuff is covered, it is. So again, you can reach out to Linda Powell. We spoke of her earlier. You can reach out to the Occupational Health Department, and they can help you get the care you need to quit smoking if that's something that you're looking to do. So here we have the 2017 medical contributions, and the standard rates, what we historically have paid for our medical benefits, have gone up this year. They've gone up because we've added the 90-day refills back to the pharmacy plan. They've gone up because we are charging part-time employees the same rates as full-time employees now. So historically they paid a little bit more. Now they're going to pay a little bit less. It's gone up because of just general utilization, right, how much we use our plan. And they've gone up, you know, just based on what you hear in the news, right? Plans are going up 25%. You hear all of this stuff. So we're doing pretty good. They went up a little bit because of wellness rewards, right? So people that are participating in the wellness rewards program are able to pay a little bit less. So the standard rates went up. But as we promised employees earlier, that if you're participating in the Wellness Rewards program, you were going to get cash for your participation in 2016 because we were transitioning, and then also you were going to see reduced biweekly premiums or biweekly payroll contributions. So you'll see if somebody's participating in the Wellness Rewards program, instead of paying $53.09 for single coverage, they're paying $25.26. So they're paying less than they paid last year, and they're paying less than the new rates for this year. So participating in the Wellness Rewards program significantly reduces your contributions for the rest of the year. So hopefully everybody's been working on this. I know last time I looked, we had at least 700 employees that were participating, which is wonderful. So hopefully we'll have lots of employees that get access to these reduced rates. So on this slide, we're talking about our new, not so new, she's been with us now for a couple years, our Hunterdon Healthcare Coordinator. And this is a great service that the hospital has for their employees. It relates to our medical plan. This is a benefit where, let's say you've just got a new diagnosis and you haven't you've gotten this new diagnosis, you don't know even where to start, and you need some help, somebody to talk to. Where do I go? Who's the best doc for this? Something like that. That is something our healthcare coordinator can help you with. Her name is Linda Powell, and her contact information is listed here on this slide. There's also pamphlets throughout the hospital. Her information is in the booklet if you're reviewing the booklet. But the Hunterdon Healthcare Coordinator adds a tremendous amount of value to the plan for our employees. She can help you if you're having trouble getting in for an appointment. Like, let's say you've been in the emergency room and they're telling you you need to get in to see a doc right away within a week or something like that, and you call up and you can't get in for 6 weeks. If you call Linda, a lot of times she can help employees or their dependents get access to the care they need a little bit faster. So again, another resource for employees to try and assist you in getting the best care possible. So now we're on page 7 of the book, and here you see information about the wellness program, right? We've been talking about our Wellness Rewards program since the springtime. Hopefully everybody's aware of it. Everybody's been working towards their 100 points. Again, if you're listening to this presentation and you got to it through the WellWorks for You website, you can get 10 points towards your activity points for the year. And then, as you saw on the previous page, you get access to the reduced premiums for the year. So, and they have tremendous value. This year they're worth about $600. So again, you saw the difference in those rates. It's significant. It's worth it. So here's, again, the information you need to participate in WellWorks for You. You go online, you register, you create your own account. You need this company ID number, this 11029 number. That's how they know which employer you belong to. Create your username, your password, and you start working through it. When you go in here, you can get points. There's an online learning presentation about the Wellness Rewards program specifically, the details of it. You go on there, listen to that first, right? Listen to it. Explains all the details about the program, and you can get some points listening to it. Okay, so that's a great place to start. So just be aware of that. This is it's worth it. It's worth the time and the effort. So on this slide, again, it's just giving you the first couple of steps that you need to go through. So you get online, you use that number, you register and link yourself to Hunterdon Medical Center. The couple things that you need to do right out of the gate are, register and do your wellness visit, do your Know Your Numbers assessment. So you go for your wellness visit, you get your blood work. Once you have your blood work, you can complete your Know Your Numbers assessment. Then you go in and you start looking at the things that you need to do to achieve activity points. Keeping in mind that if you've been doing this stuff all year, you may very well be able to get to 100 points. It has to be completed by December 1st. But if you've been for your annual physical, if you've done all of these things, you just really basically need to do the paperwork if you've been doing this all year long and you just didn't sign up for this piece of it. So just go ahead, take a look at it. It is achievable. And if you need a little help, again, stop down by Human Resources. We're happy to help you out. And there's an online presentation at this website that goes into detail about the program. So here we're talking about the Medical Flexible Savings Accounts. In 2017, there's a new annual limit. It's $2,600 for 2017. Last year it was $2,550, so you get an extra $50 that you could put away into a flexible spending account this year. It bypasses federal tax, so you're not going to be subject to federal tax on the dollars that you put into your flexible spending account. It is use it or lose it, so you want to make sure that if you elect $2,600 for 2017, that you spend $2,600 in 2017, because whatever you don't spend is going to be forfeit, and we don't want that to happen to anybody. So please be cautious when you're choosing the amount you're going to put into your medical flexible spending account, because once you've made the election, you cannot change it. That's the election for the whole year. And remember, in order to participate in a medical flexible spending account, you cannot be enrolled in the high deductible plan, right? You can be in our HMO plan, or you can be in another employer's HMO plan and have just the medical flexible spending account at $100, but you cannot be in the high deductible plan with a medical flexible spending account. And lastly, there is a debit card that comes with the medical flexible spending accounts, but the flexible spending account debit card can only be used at the pharmacy. You want to think of it as a pharmacy debit card that comes with your flexible spending account. It does not work at the doctor's office. It will only work at a pharmacy, and it will only work for pharmacy prescriptions, things that you're picking up with a script. It will not work if you're just walking into the pharmacy and you want to buy a box of Allegra or something that's over the counter for allergies. It's not going to work. That's an IRS thing, and the pharmacy's systems are going to kick it out because it's an over-the-counter product. You can still submit a claim for a prescription for something like Allegra. You just can't use the debit card to pay for it. All right, so just be aware of that as well. So here we're talking about our health savings accounts, and again, you can only have a health savings account if you are enrolled in the high deductible health plan. This year the limits are $3,400 if you have single coverage, $6,750 if you have family coverage. This is the account that rolls over, right? This one, you can put as much money as you can in each year, and if you don't spend it, it's okay, it'll roll over. It's a long-term savings tool for medical expenses, right? You can use it today. If you don't use it today, you can save it for tomorrow. You can save it for retirement. That's the value of an HSA, is that you can use it in the now, or if you don't use it, you can save it for later. Money rolls over year to year. Triple tax advantage, meaning you don't pay tax when you put money in. This is federal tax. You don't pay money on gains or earnings. Remember, there's an investment account inside the health savings account. So if you have a lot of money in there and you're not spending it, you can, on medical expenses, you can think about investing it. Then you won't pay any tax on gains or earnings, and then in retirement or later on, when you do need to use the money, as long as you use it for medical expenses, you're still not paying tax on it. You can take these accounts with you. So if you leave the organization, if you retire, if you go to another employer, whatever's happening, this money goes with you. It's your account. It's your money. Just be mindful that if you leave the organization and take that HSA with you, you become responsible for the maintenance fee. There's a $5 a month maintenance fee. The other thing you want to be aware is of that if you enroll in Medicare, if you become entitled to Medicare, meaning you've got a Medicare card in your wallet, maybe it's A, maybe it's B, but even just A, once you become Medicare entitled, you've got a card, you are no longer eligible to put new money in an HSA. The government's going to say you can't get that tax benefit. You can keep whatever you already put there, but once you've got that Medicare card, you can no longer put new money in. Okay? Be careful with that. The last thing I want to talk about is the debit card for the health savings account. Health savings account debit card is a little more flexible than the FSA, right? We said FSA, you can only use it at the pharmacy, and you can't use it for over-the-counter. The HSA debit card, you can use at the doctor's office, you can use at the pharmacy, you can use it in more places. It's a little more flexible. However, you still cannot use the HSA debit card for medications that you're purchasing over the counter, okay? So this slide's looking at our dental benefits. We have Delta Dental of New Jersey as the dental carrier that we use. It's a very popular plan with hospital employees. We still have two plans that you can choose from. There's the basic plan and the enhanced plan. The basic plan, again, covers more basic services. The premiums on a biweekly basis are a little bit less, but then so is the amount that you can spend, right? You get a $1,000 maximum on this plan, instead of a $2,000 maximum, which is on the enhanced plan. So if you're in the basic plan, you have a $25 deductible for single, $75 deductible for family. Each year, each person in the plan can be paid, they'll pay up to $1,000 per person in claims. And basically they pay 50% of everything, right? If you look down the list here, it's 50% of your preventive services, 50% of basic services. Everything that's covered is paid at 50%. So if I go for a cleaning in the basic plan and the cleaning is $100, I'm going to pay $50 and Delta Dental is going to pay $50. If I go for a filling or something like that and it's $50, I'm going to pay $25 and Delta Dental is going to pay $25. So every service that's covered is going to be covered at 50%. I'm going to always pay half, okay, until the carrier spends $1,000 and then I'm done. In the enhanced plan, there's more services covered, and they cover more, right? So you still have a $25 deductible for individual, $75 deductible for family, but they will pay up to $2,000 per person on the plan, okay? So you have more dollars eligible to spend in the enhanced plan, and they pay 100% of your preventive services. So that would be x-rays, cleanings, things like that. So if I go to a cleaning at the dentist and the cleaning is $100, Delta Dental now is paying the whole thing. I'm not paying anything on the cleaning, okay? Maybe fluoride if I'm over 19, something like that. Basic services, again, we're talking about endodontics, fillings, extraction, stuff like that. Now the enhanced plan pays 80% of the cost instead of 50%. So I'd only be responsible for 20% on the enhanced plan. So again, they're paying a little bit more for me in the enhanced plan. Once you get to major services, now the enhanced plan also covers 50%, but the enhanced plan covers implant coverage. The enhanced plan will cover orthodontia services for children. And you get, on this plan you get $1,000 per child per lifetime. So basically you get $1,000 towards orthodontia for each child that's on the plan. And then there's also what we call our rollover benefit, and that is on both plans. So as long as you're going in and you're getting your teeth cleaned and maintaining your care, any unused portion, a percentage of the unused portion, if you don't use the whole plan, like so you get that $2,000 worth of spend each year. If you don't use all of it, you could roll up to 25% of what's left, as long as you're getting your teeth cleaned every year. So they let you carry over whatever you haven't used year to year. But you got to make sure that you're at least getting your teeth cleaned every year, because if you skip 1 year, that wipes out and you lose your carryover balance. So just be aware of that. So here's our contributions for the dental plan. They did go up a little bit this year. They went up 1%. So not a significant amount. I mean, I think the rate, was less than $1. It was a few cents for single and less than $1 for family, but we did see a slight increase, and that was just based on our utilization. That's a very popular plan. Employees like to use this plan, and when you use the plan, the costs go up. So, but we were able to negotiate it a little bit, so it didn't go up too much. It went up 1%. So here's our vision plan, and absolutely nothing has changed on our vision plan this year. So the contributions have remained the same, and the coverage has remained the same. So you're eligible under our vision plan if you elect it for an eye exam every year. So you can go for one well eye exam each year, and it's a $15 copay for that. There's an allowance for frames. There's an allowance for featured frames. There's a 20% savings if you go over that balance. And you want the really fancy frames, you get 20% off anything over your allowance. There's all kinds of lens enhancements. Again, very popular program with employees. Be mindful, though. I mean, how often do you buy glasses, right? So again, what's open enrollment for? It's to pick up or to drop coverages. So if you don't buy a pair of glasses and you're not buying contacts every year, do you need to have this plan every year, okay? Just think about it. Don't buy something that you're not going to use. Your medical plan, if you have our medical plan, you have the option of a well eye exam every 24 months on the Aetna plan, and the Aetna plan also provides very good discounts for vision if you're using like Pearl Vision and some of those other places. So just be aware that you have coverage under your medical plan. Do you need the vision coverage? Really think about it. And do you need it every year? And you may, right? You may have a family with a bunch of people that wear glasses, and it has value to you. But if you're single or, and you're buying glasses every couple of years, do you really need this plan every year? That's a decision that you need to make. But just think about it that way. Here are the contributions, and again, they have not changed. These are the same contributions that we paid last year, single, U+1, and family. So at Hunterdon, we have a great deal for employees for memberships to either our own health and wellness centers at Hunterdon or HealthQuest of Hunterdon. So we have an alliance with HealthQuest of Hunterdon. The Hunterdon Health and Wellness Centers are ours, and you can join any of them for $29.95 per month, which is a very good deal. A lot of employees have taken advantage of this. Major differences, really, HealthQuest of Hunterdon is $29.95 per month, and it's $13.82 per pay period. And when you enroll in this, you go online during the open enrollment process, you elect it, and you will see $13.82 start coming out of your paycheck. Each pay period. You still need to go through the enrollment process, though, and that information is online when you go through open enrollment. If you're already established in this, it's no big deal. It'll roll over. But if you would like to enroll for the first time, you select it during the open enrollment process. The payroll deductions will begin in January, but you must continue and finish the enrollment process, which means there's 2 forms that you have to complete. Verify with Human Resources, and then take the information to HealthQuest so that your membership is active for January. When you're going through open enrollment, you also have the option of electing information really about the Hunterdon Health and Wellness Centers. You can elect that you'd like to have a membership with them. You would need to contact them, or they will contact you to set up a payment for them. They take the payment differently than HealthQuest. It's not payroll deduction. They would set up a payment plan. Generally, they pull it out of your checking or savings, whichever you choose. But it's the same cost and many of the same benefits in both places. So again, great deal, $29.95 per month. You can elect it during the open enrollment process for either one of these. You just need to continue on and do the paperwork to actually complete the enrollment for the memberships to begin in January. All right? So here's a little snapshot overview of our 403B savings program for employees. And these are the criteria or the definitions of who's eligible for the plan. So you see that all employees are automatically enrolled in our 403B upon hire, because we strongly encourage that everybody save for retirement. So if we put everybody in at 4% when they originally come into the organization, and you will be auto-increased each year 1% until you get to 6%, okay? Unless you take control of the account, right? So we'll default you in at 4%, and if you do nothing, the next year we're going to bump you up another percent, and then a year after that we'll bump you up another percent. But if you go in and you start making changes to your elections and doing different things, and you kind of take control of that account, we're not going to auto-increase you. You can set yourself up to auto-increase, or you can go in each year and increase your contribution yourself. But once you take control of that account, we're not going to override anything. But if we auto-enroll you and you don't do anything, we're going to keep bumping you up 1% a year until you get to 6%. So all employees are enrolled to contribute their own money, but there are some employees that will get money from the employer, all right? So what we call the match and the core contributions. So employees that would not be eligible for the match and the core are per diems, residents, employees that are already receiving the pension from the hospital are not eligible, so you'll see the list of the people there. Again, other requirements in order to be able to be eligible for the hospital's contribution or the hospital money, you have to be at least age 21. You have to have at least 1,000 hours in a plan year. You have to be in the plan for a year, and you have to be in the plan on the last day of the year to get the hospital money. That's important. So that's an important thing to consider if you're retiring, if you're separating employment from the hospital. Don't separate employment on December 15th, right? You stay until January 1st. You're going to get your money in the plan. So, and we talk to employees when they're thinking about retiring, and we talk about that transition. Retire on January 1st and get that contribution into the plan the last year that you're working. So again, just some general information about the plan here. So here's again another snapshot of the 403B. Here we're looking more closely at the match and the core and how they work. So the match, the employer money, is based on how much the employee contributes to their own retirement. So if the employee contributes 4% of their own eligible compensation, the hospital will match 50% of that, or half of 4 is 2, right? So if you contribute 4% of your eligible compensation, the hospital will match half, and they will deposit 2% of your eligible compensation into your 403B savings account, all right? The core contribution is based on years of service. So if somebody has worked 1 to 5 years, they will get another 2% on top of the 2% they got for their match. If somebody works here 6 to 10 years, they'll get another 2.5% of their eligible compensation deposited on top of the original 2% match. 11 to 15 years, you get 3% on top of that 2% match. 16 to 20, 3.5% on top of the 2% match, and greater than 20 years, 4% on top of the 2% match. So by the time you're here 20 years, you're getting 6% from the hospital. So you're getting the match at 2, and then you can get up to 4% in a core. So it's the additional years of service that drive up the increased contributions from the employer. Vesting, of course, there's a couple more details here. Vesting, you need to be here 3 years with 1,000 hours to be able to keep the hospital's money, the hospital's contributions that they've put in for you, but your money is always yours, right? Any money that you put into the 403B is always yours. You don't have to vest. You're 100% vested in your own contributions. It's the hospital's money that you need to be here 3 years with 1,000 hours in order to be able to keep that money. And then it goes into a little bit more detail here on fees and the Roth and the loan provisions that are available in the 403B as well. So here's a slide that kind of talks about how the performance of our 403B is managed or monitored. So the mutual funds are made available to employees in the Hunterdon Healthcare's 403B savings plan, and they're monitored on a quarterly basis by the plan representatives, right? We have Hamilton Kavanaugh. There's also an investment policy statement that sets criteria for fund performance, and when funds fail to meet that criteria for 3 consecutive quarters, then a recommendation may be made to the hospital's pension, real estate, and investment committee to take corrective action or to replace the fund. All right. So factors that they look at when funds are being monitored, they're looking at how does that fund perform against other funds that are like it, right? How does that fund perform relative to its risk, its assumed risk? They look at how long has the fund manager been there, who's managing this fund, and what do the fund expenses look like, the fees and the ratio of those expenses. So just so that you're aware that there's a tremendous amount of effort that goes into monitoring what's being offered to employees in this 403B savings plan. All right, so we have a lot of employees that leave the organization and they want to keep their money here because they know that there's a lot of effort that's made to make sure that these funds are performing to a certain level and that they're meeting a specific criteria, that just not putting your money someplace and nobody's ever looking at it again. These funds are monitored very closely and very regularly. So the hospital also offers a dependent care flexible spending account. This account, again, is designed for tax savings, right? The money comes out of your paycheck, it bypasses federal tax, and you can use this to pay for child care. You can use this to pay for camp for children. For child care expenses, basically, you're saying that I need some assistance taking care of my child so that I can work, right? So you're using this dependent care account so that you can work. They limit this to children up to the age of 13. So if you're setting aside money for child care and your child turns 13 this year, keep that in mind, right? Once the child turns 13, they're no longer going to be eligible for using the money that's in this account. It's use it or lose it. So if you don't use it, you lose it. So you want to be careful and really plan what you're electing here in terms of the dollar amount. You can put up to $5,000. You can only make the election one time. It's an annual election. So if you elect $5,000 for January 1, that's it. You can't change it after that. Claims are administered by Aetna, so the money comes out of your paycheck, it goes into an account, and then you submit the claim to Aetna, and Aetna reimburses you. So they do the administration of the claims at Aetna. And then this also can be used for elder care. So if you have someone in the household, it can be a spouse, it could be an adult child, somebody that needs assistance with daily living. It's based on medical need. A dependent care flexible spending account can be used for that as well. So this slide talks about our HELP legal plan. That is the Hospital Employees Legal Plan program. And it offers employees access to legal guidance, if you will. If you have an identity theft going on, if you're purchasing a home and you want to talk to somebody about real estate transactions, if you want your will prepared, they will prepare a will for you for free. If you get a traffic ticket, you need some assistance there. These are more simple, general things that are covered. If you're going through a divorce, it's not going to be covered under this. I mean, they can give you a discount, they can give you some guidance as to where you could go, but this legal plan is just to kind of help you out with some general information, references, very basic legal services. But they will give you some assistance in terms of discounts and referring you to other lawyers if you need something a little bit more than the plan offers. So this slide is referring to our paid time off program. So remember that the PTO carryover cutoff is coming. This year it is December 24th, Christmas Eve. So the maximum PTO carryover amount is 96 hours, and that is for somebody that works 40 hours a week. So somebody who's scheduled regularly 40 hours a week can carry over 96 hours. But if you are scheduled 30 hours a week, you can carry over 72 hours, okay? If you are scheduled 20 hours a week, you can carry over 48 hours. So just be aware that the most you can carry over is 96 hours, but that's for a full-time employee working 40 hours a week. After that, the amounts that you can carry over are prorated. If you are having a problem with PTO carryover and the cutoff, something you can think about doing is our PTO buyback program, right? So if you can't use up all of the PTO that you have, not my problem. It's a problem from some people. It's not my problem. But if you're not able to use up all your PTO, you can buy back 1 or 2 hours of PTO on a biweekly basis. So each pay period, instead of having that PTO time that you're accruing put into your bank, you can put it into your paycheck. So you can get an extra hour or an extra 2 hours worth of pay in your paycheck and have less put into your bank to use later. And that will help people that have issue with trying to use up the PTO that they're accruing. Please remember, though, that if you've elected this in the past, it does not roll over. So if you still want to be able to get that PTO in your paycheck, you need to go back out and re-enroll for it during the open enrollment period. And if you are somebody who has, PTO that you know that there's no way you're going to be able to use it up and get down to the PTO carryover cutoff, you could consider donating some of that PTO to what we call our PTO donation pool that employees can request PTO from in the event that they have like a significant life event going on and they're out of PTO. If they have something really significant happening, they can request a PTO donation. So here you just want to kind of look at the last couple of things here. We just talked about, please be aware of your PTO balance. Try and do the best you can to not lose your PTO. Again, PTO buyback, you can make a donation. 403B, please, you want to try and get the most you can from the hospital, right? You want to maximize your retirement savings. So you just want to take a look and make sure that you are getting to the 4%. If that's what you were trying to do, just make sure that you're going to get there for the end of the year, okay? And then the other thing you want to think about is if you have children that are getting to age 19, remember that at the end of the year, we're going to look at all the dependents on our plans. If your child is turning 19 in order for them to be eligible for dental and vision over the age of 19, they must be enrolled as a full-time student. So just be mindful of that. If they're not, they'll be issued the opportunity to continue those benefits under COBRA. If they are going on to school, you want to provide student status information, and we'll be collecting that during the audit this year. So just be kind of aware of that children that are aging off the plan at 19 have to have full-time student status to continue on dental and vision. Medical is a non-issue, right? Under the new ACA regulations, children can be on our medical plan until the age of 26, regardless of student status, regardless of where they live. If they are your child, they can stay on the medical plan until age 26. But if you have a child that is over age 19 or is age 19, and this year, you want to be careful about their dental and vision information. All right. So hopefully this was helpful. I hope you got your points if you needed to get points for the Wellness Rewards program. And if you have any questions, again, questions, comments, feedback, please let me know. My email again is arice, R-I-C-E, @hhsnj.org, or you can call me at extension 6133. Thanks. Bye-bye.